Hello, my name is Jen Lyle, and I'm the CEO of SafeCare BC. Before we start, I'd like to acknowledge that we're hosting this session on the traditional lands of the Coast Salish people, and we extend our appreciation for the opportunity to hold this dialogue here today. As many of you are joining me from across and joining us from across the province or even across the country, I invite you to acknowledge your own territory just using the chat function in the conference app. And I would also as well just point out, if you want to have any questions for our panelists today, you're also welcome to use the chat function to populate those throughout the discussion, and we'll hopefully have some time to get to them towards the end. I'd like to also welcome everyone here viewing today to what I believe is a very important topic, the mental health and wellness of the workforce in the seniors care and the seniors living sector. I'd also like to take a moment to thank our sponsor, BookJane, for making this dialogue possible. We titled this session Mind Over Matter to reference the great strength and resilience that those working in the continuing care sector have demonstrated over the last 18 months or so throughout this pandemic. But we all know that the pandemic has been extremely challenging mentally, putting an incredible burden on our frontline staff, our managers, and leaders. Frontline workers have had to deal with increasing death rates, massive workloads, and even at times limited access to personal protective equipment, all while grappling with their own personal risk of contracting COVID-19 and whether they might bring it home to their families. Leaders too have been stretched to the limit, managing outbreaks, worried family members, and anxious staff, all while under intense media scrutiny. Mental health impacts have been numerous, including stress, anxiety, insomnia, burnout, just to name a few. To discuss these issues and more, we have a diverse panel of experts who I'm going to introduce briefly and then welcome them to provide some opening remarks. First, we have Jonny Morris, who is the CEO of the BC Division of the Canadian Mental Health Association. Welcome, Jonny.
Thanks so much, Jen.
Next, we have Dr. Naz Havaei, who's an assistant professor at the University of British Columbia School of Nursing. Naz, thank you for being with us here today.
Thank you so much for having me.
And then third, we have Michelle Embury. Michelle is a healthcare assistant who works in long-term care in Kamloops. Michelle, welcome.
Thank you.
And finally, we have Karen Biggs, the CEO of Meadow Place in Abbotsford, as well as the past president for the PC Care Providers Association. Karen, thank you for joining us.
Thanks for inviting me, Jennifer.
Now I'm going to turn it over to our panelists to say a few words and perhaps tell us a little bit about what you're hoping to touch on during today's session. Naz, why don't we start with you?
Sure, thanks, Jennifer. So I'm a health services researcher and an assistant professor at UBC School of Nursing. And my program of research essentially focuses on studying and addressing workplace psychological health and safety needs of healthcare workers. And the reason I have a vested interest in this topic is because research has repeatedly shown that the health and well-being of healthcare workers has a profound impact on their ability to deliver quality and safe care to patients and their families. And research evidence, including my own work, essentially shows that the pandemic and pandemic-related issues have had serious negative impacts on the mental health of healthcare workers across the healthcare spectrum, but significantly more so among long-term care or continuing care workers. And this is not at all surprising, given that the long-term care sector was essentially the hardest hit sector of the healthcare by the COVID pandemic. And so given this evidence, and also in light of the documented staffing shortages in this sector, what I hope to communicate today is that there is an urgent need for strategies and interventions that will protect the mental health and safety of long-term care workers in the workplace, both from a health promotion and prevention perspective. And so what that means that we need to be paying careful attention to those systemic issues or root causes of poor workplace mental health that are essentially modifiable. So it's a pleasure to be here, and I really, really look forward to our discussion with other experts on the panel, and hope that in this short time we can essentially come up with some recommendations or next steps. Thank you.
Thank you, Naz. I know we're all looking forward to digging into this issue a bit more, and really welcome your perspective as a researcher on this one. Michelle, why don't you follow up next?
Yeah, it's been quite the little challenge over the last year and a half dealing with all of this. From a mental health perspective, a lot of us are feeling guilty if we have to call in. So we know that leaves our coworkers short. And then on the other side of that, we're frustrated because we're constantly having to work short. We're frustrated because we don't get our vacation time. And then it's the other side that it's heartbreak from seeing our residents pass away with family members present. So I'm really looking forward to talking about this further and seeing where we can go with it.
Thank you, Michelle. I know we're all really eager to hear your perspective on this one as well. Karen, why don't you follow up for us?
Okay, thanks, Jennifer. I've been a nurse now for 45 years. I've been in long-term care for 41 years. I've been here at Menno for 8. I can honestly say that this has been the worst year in my entire career. If you remember back to when the pandemic was declared on March 11th last year, by that time, Lynn Valley had already had 2 deaths. The second care home that was hit was Harrow Park Centre, which was the care home that I used to be the DOC and then I was the CEO at. So all of a sudden, I was getting phone calls from staff who were distressed because their CEO had gone off sick and they were afraid. 8 months later, we had our first outbreak in November, on November 17th, here at Menno Place, and we care for 700 seniors. We started with 1 positive resident, and eventually it spread to 43 people on 1 unit, 42 people, and 25 of my staff. We cried when our first resident died, which was about 2 weeks into the pandemic. We cried with everyone who died, and it was so tragic because we had to be family for people who didn't have family coming in because of people being locked out. It's been a very difficult year. My leaders are exhausted. When we had the outbreak, we were doing calls twice a day with Fraser Health. That's 7 days a week. We're all still exhausted. We haven't had time to grieve what we've gone through. We're still going through it. And our campus, we adopted the psychological health and safety standards very early on, I think back in 2015. But we haven't even had time to cope with our own feelings, to cope with our exhaustion. So trying to build resilience in both my leaders and my staff is going to be a huge, huge goal for moving forward. So that's why I'm excited to share best practice here and to talk about what we're going through so you know that you're not alone. We're all going through this, and we have to figure this out together because we already are seeing people say, I've had enough, I'm retiring. And we can't afford to not have people come and work in our sector. So thanks very much. Look forward to the talk.
Thank you, Karen. I just want to echo my thanks again for your participation in this and sharing some of those stories, because I think that's, you're right in that there's so much that we need to talk about and discuss, not just in terms of reconciling with what's happened, but what we're going to do about it going forward. Jonny, do you want to tie us off with your opening remarks?
Yes, thanks so much, Jen. Pleasure to be here joining you from unceded Lekwungen territories, and what an honor and a privilege to be on a panel with Michelle, Karen, Naz, and Jen today. I've been in the field of mental health for about 25 years, and I think much like Karen's comments, have not experienced a year as challenging as this as a mental health service provider, but also as an advocate and an organization that cares so deeply about the mental health of all folks across this province and country, and particularly given the subject of today's conversation, folks working in continuing long-term care, community health care. The key pieces that I think are so important to underpin this conversation, I think was underscored by Naz's first remarks there. There is such an imperative to ensure that the mental health and well-being of the healthcare workforce is top of mind as we start to navigate our way through the these next phases of the recovery from the pandemic. on behalf of my association, there's such deep gratitude and sincere appreciation for the risks, the concerns, the worries, and arguably some of the most acutely stressful working environments that we can imagine from outside of the sector. And so today would want to communicate the need to pay close attention to what's happening, as Nas was saying, pay close attention to those modifiable structural things that we can do that in many ways existed before the pandemic. And to absolutely ensure, as we see a light at the end of the tunnel, a light that's getting brighter around some of the receding risk around the virus, at least as we're being informed, and increased vaccination rates, that we absolutely ensure that the mental health and substance use impacts of this pandemic, particularly for healthcare workers, continues to be addressed going forward.
Well, thank you for that, Jonny. And it's interesting, you guys have all touched on these themes around the challenges people working in continuing care have experienced right now from a mental health perspective. Michelle, I want to go to you first with this question, because I want to talk about that a bit more in terms of what are those most significant mental health impacts that are being experienced by people working in continuing care, and what events or factors specific to long-term care or continuing care do you think have contributed to that?
Lots of things. At the very beginning, it was lack of PPE. Now we've kind of got that under. We've got that managed, but it's still lack of staff, lack of, and I don't want to say empathy from the managers, because that's not true, but I think that it sometimes can feel that way, because we're all in this together, and that's so true, but everybody has their own role, and I think sometimes we get so caught up in our roles that we forget that other people are struggling as well. And the big thing is lack of staff, lack of continuity of care, and now that the families have been allowed back in, it's been really good. But before, it was really, really hard to hear some of the things the residents were saying to us and asking us, like, where'd my family go? Why aren't they here? And you don't have answers all the time for them. And that takes a whole other toll that there's no training for that. You just have to work through it and redirect as best you can. But, I'm tired, constantly living in a state of tiredness. We're working short all the time, and it's just have to get up and go to work and put a smile on your face, because at the end of the day, you're there for the families, the residents, and no one else.
Thank you for sharing that, Michelle. And Karen, I know you mentioned that too in your opening remarks, just about being tired and seeing the drain that's had. I'm curious to know your thoughts on this, particularly if we think about it from like a long-term mental health burden and what that might do. I know Michelle touched on it in terms of staffing shortages, but for example, are we going to see a mass exodus of people leaving the continuing care workforce because of this? Curious to hear your thoughts.
Well, unfortunately, I think we are going to see a fair bit of retirement. Even within our own administrator group, there's already 3 people who've given their notice for this year. People are reevaluating life and how much effort it takes to try to continue going on, especially since there's no light at the end of the tunnel. There's a little glimmer because we really don't know the vaccination rates. We don't know the disease rates going forward. And we don't know how the changes are going to affect us, to do with what Bonnie Henry does in the province, or to do with long-term care changes. So, the unresolved grief is a big concern for me, because many of us, if you saw the release of the book by Andre Picard and the criticisms of long-term care in Ontario and Quebec, we're feeling like we've let the public down. We're feeling a resistance for people moving in. If you look at the vacancy rate in my apartments here on our campus, we've got many, many vacant suites, because people have lost trust that they can put their people safely in our care. So as a sector, it's going to be hard going forward to remarket ourselves as a place you want to be when you're a senior, because it felt like we were being holders of jail keys for a while there, and it didn't feel very good. It's not who we are. We've been brought up in a very social model, and basically the last year has been an antisocial model, which has been really hard for all of us ethically. It goes against who we are, and so that kind of moral distress really impacts how each and every one of us feel.
No, thank you for sharing that, Karen. And Naz, I wonder if we can go to you next, because Karen and Michelle both touched on some important elements around what makes the healthcare workforce, the continuing care workforce, unique, and also some of those factors that might either protect or exacerbate somebody's exposure to psychological harm. I'm wondering if you can share a bit about those factors that organizations, what makes a difference? What helps protect people against psychological harm, and what can put them in harm's way?
Absolutely. Well, actually, research evidence, Jen, shows that workplace factors or risk factors are essentially among the most important predictors or contributing factors to health workers' mental health. And a recent study that my research team and I are currently working on is essentially evaluating the impact of workplace conditions on nurses' mental health using a tool called the National Standard of Workplace Psychological Health and Safety that Karen also mentioned. This sort of resource or tool is developed by the Mental Health Commission of Canada, and the tool looks at 13 workplace conditions. And our findings essentially show that, a workplace that protects staff's mental health by preventing unnecessary stress, by promoting effective workload management and adequate work-life balance, can essentially mitigate adverse mental health outcomes, including things like anxiety, depression, post-traumatic stress disorder, and burnout. And this is not to say that other workplace factors such as presence of effective leadership, collegial relations, or having clear roles and responsibilities are not important, but that these three specific conditions around workload management, staffing, sort of eliminating stress from the workplace when you can, and also sort of maintaining work-life balance. These three conditions are certainly more important and consistently predictive of all of those mental health outcomes that I just mentioned. One caveat, however, in this research is that it's province-wide, it's with BC nurses and not specific to the long-term care sector. So at this point, I'd have to sort of say that we don't quite know if workplace predictors of staff mental health in long-term care settings are similar or different from other healthcare sectors.
Thank you for that, and thank you for sharing that. I wonder if Karen and Michelle, you have any other thoughts, because I know both of you mentioned, just to hear Naz speak about how workload factors into psychological health and safety, and then hearing from both of you in terms of how that's really impacted your experience working in the sector. I wonder if you have any other thoughts to share on that one.
Well, I sure do, and I'm sure Michelle does. Workload in our sector has been huge since the beginning of time almost. And it's not getting any lighter. We've seen the clients change in the last 5 years. The Closer to Home program is working. It keeps people at home much longer. But that means when they come to long-term care or assisted living, they're very, very frail, and the workload is very, very heavy. And the hours per resident day have not kept up with that. So our staff work full out all the time. There's no downtime. There's no real easy time to just sit and chat with somebody because they're on to the next task. One of my care aides right now is working as the visitation host, and she said to me this week, she said, it's so nice to get to know the families as people. And I said, well, don't you get to do that in your role as a care aide? And she said, no. She says, we are so busy doing tasks that the minute the family walks in, we beat aloft and leave their person to them so we can go care for somebody else. So when you talk about work-life balance or work balance, It's very, very hard. And with the single site order, we are so short of staff. Staff are working overtime almost every day. And people are exhausted. And I don't see a lightening of that at this point. And I'm pretty sure Michelle would say the same.
Yeah, I'd have to agree. The workload isn't getting any lighter. And, over the next 10 to 15 years, I suspect it's going to get heavier as well. So, and we're all working doubles, we're all working overtime, and it's exhausting.
I want to drill us up a little bit of a level because we've heard some of these themes that speak to those wider systemic factors. And I wonder, Jonny, if I can go to you for this one to start us off, but I'm wondering from like a systemic lens, what factors do you see as having contributed to this mental health crisis? And what policies or practice recommendations do you see being necessary going forward to help address what's happening right now in the seniors care and seniors living sector?
It's an excellent question, Jen. I think writ large, what the pandemic has done, it has widened the fault lines that have existed prior to the pandemic writ large with regard to the mental health and substance use system. So before I kind of drill down on the continuing care sector, you just need to look at the ongoing additional public health emergency related to the overdose epidemic, and how the coronavirus pandemic has exacerbated a devastating toll in loss of life there. And I think from our own research and analysis, much like Naz's, in the lead up to the pandemic, we have a mental health and substance use system that was already struggling to meet demand. And I think many would cite challenges around fragmentation and access to care as being key challenges. One of the things that has emerged out of the pandemic, I think, has been a striking convergence of prioritizing workplace mental health, and I think, and we'll get to this likely later, but I think there's been a real exposure for many around the distress that the pandemic has caused. The outgoing CEO from the Mental Health Commission of Canada talked about how this pandemic has revealed the imperative to not only protect our bodies, but our minds. The pandemic has brought into stark relief the implications of mental health in workplaces. I think our colleagues on this panel, to the specifics of your question, have already, I think, exposed some of the systemic fault lines that have kind of laid some of the kindling underneath the workplace stresses that have been described. And so, as Naz was describing, those workplace factors, those features, workload, clarity of leadership, clear leadership and expectations, workplace culture, all of those pieces, if they weren't in a healthy spot prior to the pandemic, they've definitely, I think, been weakened and loosened in the midst of it. And I think we're seeing, we saw evidence of this after the SARS and MERS public health crises in the past decade, where healthcare workers are uniquely positioned to, of course, respond, but also be called upon to respond, in your words, Jen, answer the call, and be vicariously witness to and directly experience profound stressors at an individual level. So the moral distress in care, profound experiences of bereavement. I think Karen underscored that very, very poignantly with her comments. And all of this whilst juggling their own lives, healthcare workers having to go home and worry about transmitting the virus to loved ones and having routines turned upside down. So there's been a perfect storm here. So on the one hand, mental health has been raised up as a pressing priority, one we've been fighting for 103 years, and the workplace being arguably a site of profound concern. That's what we're discussing here. But I think, to the comments of all of the panelists here, the workplace being a site of opportunity to both tackle the systemic, and the individual. And I think in closing, the two pieces I would emphasize is we have to think about both the individual and the context and the environment going forward. We absolutely need to scale and leverage a workforce to respond to workers with perhaps growing intense needs around their mental health and well-being. But we also need to think about the determinants of mental health and well-being: food security, housing security, income security, balance, access to supports, the ability to be free from stigma and recrimination if you raise the fact that you are living with a mental health problem. All of those things have to be put in place. And on the stigma point, we have a road to go, because I think for a healthcare worker to raise their hand and say, I'm struggling with my mental health, there are real worries about security of job, security of license to practice, all of those pieces. So what's required is both systemic and individual action going forward, Jen.
Well, thank you for that, Jonny. And I want to seize on a key word that you said there, in that opportunities. Because I'd like to talk about that now in terms of those opportunities for change or those opportunities for action. And I'd like to hear from all of you on this one, but perhaps Karen, we'll start with you first, just from your perspective as being with an organization that was an earlier adopter of the National Psychological Health and Safety Standard. What measures or approaches do you think organizations can take to ensure that staff feel supported even when there are these challenging situations or circumstances?
Yeah, thanks, Jen, for asking. You know, we've done a number of things on this side. Even during our outbreak, we had mental health resources that our staff were able to access online from the unit of the outbreak. We talk a lot about mental health here, and one of the big things is trying to encourage people to access what works for them. For instance, you know, many of us, when we did the survey for the CDC about the impact of COVID on their lives in the last year, it was an eye-opener to me because, you know, a year ago, I drag a boat race 3 times a week. I went to the gym 3 times a week. For the last year, I've done none of those. So even the normal coping things, you know, going to a concert, going to a church, gathering with friends, we haven't done a lot of those things that we actually had built in for our own mental health because of the restrictions. And in fact, my leadership team talked today saying, how can we build resilience in the staff? They're missing their potlucks. They're missing their getting together. You know, we're still cohorting units apart from each other. They don't even change in the same changing room right now. So, you know, looking at Bonnie Henry's plan, how do we get the campus and our lives back to normal so that the coping mechanisms that we used to have that worked really quite well can maybe come in again? You know, but the first thing on this campus that we do is it's okay to not be okay. And we talk a lot about that, and we talk a lot about saying, you know what, I just can't do it. I'm hitting the wall. I just can't do it today.
Thank you for sharing that, Karen. I think your piece there about saying it's okay to not be okay ties really nicely in with Jonny's comments too about people not feeling okay to put their hand up and say, I'm not doing okay right now because of the concerns of stigma. So thank you so much, and kudos for being a leader in that. Michelle, I'd be curious to hear your thoughts. Like, as somebody who's living and breathing this reality right now, what would work for you, or what do you see as those needs?
For me personally, I've really had to look into self-care and what exactly it means. I'm for my tools, because I do have depression, I do have anxiety. What I've learned, self-care is not just going to the salon, because we can't do that right now. Well, we can now, but at the beginning of the pandemic, we couldn't go to the hairdresser and make ourselves pretty. We couldn't go get our nails done. I had to look at other ways. So for me, I wrote, okay, you know, this isn't working for me. So I changed my work schedule. I moved from a day shift to an afternoon shift. That was one thing that worked for me. It's not going to work for everybody. I made it well known to everybody that sometimes when I hit that wall, I'm done and I need a break. And even if it's just a 5-minute break. So luckily at my facility, we're allowed to just take 5 minutes if we need it, and just take a little breather. And, sometimes for me, if I'm hitting a wall, I'll go sit with a resident and I'll just take that moment with them, because that helps me. Because sometimes we just need that human connection. Sometimes I'll talk to a coworker. So I really had to look deep inside myself and really learn and rethink how I approach mental health. Because there's just not as many, there's not the access available that I believe that there should be for healthcare workers, for many, many, many reasons. Time, just not the people available, and the stigma. Because people don't really want to go to their boss and say, you know what, I'm feeling depressed, and they don't know how to fix it. So I had to really look into deep inside of myself to find what works for me. And I also recognize that what works for me isn't going to work for somebody else, because, for some people, sitting for 5 hours at the hairdresser is a huge thing for self-care. That just causes me more stress. So my main thing was just changing up my routine and talking to my family and making sure I had those systems for myself in place.
Well, thanks for sharing, Michelle. I think one of the themes that's coming out of this right now is just how there isn't necessarily a one size fits all. And then the other thing too is just the degree to which the pandemic has disrupted our usual coping mechanisms, and how a lot of us have had to be very creative around how we find new ways to support the people who may work with us, or to ensure that we are ourselves supported. Jonny, I wonder if you have some insights or comments in terms of just like those resources or things that are available to employers, organizations right now to help support people in their psychological health and well-being.
Thanks, Jen. I mean, one thing I might say before bridging into your question is just a profound acknowledgement for Michelle's account, right? Michelle being open about your own lived and living experience is huge in a public forum like this, at this conference, and for you to sit alongside us and hold, whether it be courage, whether it be vulnerability, whether it be passion for the cause, to share your own experience is key, and to bring myself right alongside you. I mean, lived with depression for the past 20 years myself, and if it wasn't for a conversation 20 years ago, I likely wouldn't have made it through school. And so to be here as a CEO 20 years later and be able to speak from a platform about my own lived experience is key. So I just hold up my hands for Michelle sharing her experience during this conversation. Could we have done that 10 years ago? Probably not. And that's a way of showing that we are pushing back stigma, but we probably have another 10 years of work to do to really truly make it safe. That links into my response to your question, Jen. There are resources and pieces that are out there and helpful. And I think Michelle's commentary there of the barriers is something to pay close attention to. So, I'm very proud of the work that we've done together, Jen, with Your Health and Safety Association and the Canadian Mental Health Association and other partners to launch Care for Caregivers just over a year ago, an online learning platform that's available for the continuing care and community health sector here in BC, that's been visited thousands and thousands of times, with thousands of people engaging in learning opportunities about mental health. And so that's a space where I think people are experiencing community. With some targeted and tailored resources. And we're very grateful to the province, the Ministry of Mental Health and Addictions, for supporting us with that vision so early on in the pandemic. And of course, Care to Speak, which is a confidential mental health support service operated by peer volunteers with experience of the continuing care sector to provide a safe space, because as Michelle, I think, has attested, people may or may not have access to extended healthcare benefits, may or may not trust their employee and family assistance program, may not know where to turn. And so, that's a good space. I think to Naz's and Karen's comments, for employers, like the 13 factors in the national standard on psychological safety in the workplace is a lot to chew on. I mean, there's a lot of factors there. But for employers to start to signal that mental health is a priority, that there is an imperative to act. I was on a call this morning with manufacturing folks, and there was a lot of comment there about the power of leadership within an organization, leaders like Karen saying this is important. And how that can open up conversations for employees to interact with each other peer-to-peer, learn about the resources that are available, whether that be extended health services offered by the union, services offered like care for caregivers, starting from the top and explaining and providing psychological protection and psychological support. You're already hitting one factor under the national standard, investing in making available and making it okay to reach out for services. You're already hitting one of the factors under the banner of feeling protected psychologically and having access to psychological care. The final thing I would say, Jen, in response to your question around resources is at CMHA, we often say reach out. And there are resources out there, 310, 6789, that's access to confidential mental health support, bounce back, what have you. But sometimes it's hard to reach out for stigma reasons, or because the services don't exist, or there's a wait list. And so we've really been encouraging people to reach in as well, and to reach into each other and build some of that connection that's been in short supply in and around supporting each other's mental health and well-being. Going forward, we know we're going to need more intensive forms of support for your sector beyond peer support. We're going to need spaces where people can talk about occupational stress injury, PTSD, complex bereavement. We heard that from Dr. Stephen Taylor from UBC earlier this week. We're going to need to think about those layers of care that are going to be required to prevent injury from worsening, and really to think in the same ways that we respond to physical injury so they don't worsen. We can absolutely prevent, intervene early, and support recovery from mental health and substance use impacts if the resources are there and available. And I think that's what this conversation that you're leading, Jen, can hopefully trigger and start during the coming months of planning and action.
No, thank you for that, Jonny. And of course, thank you for all the work that you guys do at CMHA BC Division in terms of providing support services and helping destigmatize the larger conversation about mental health and wellness. Because that's something that we've heard very clearly on this call today, is the importance of having that open and honest discussion about how we're doing and recognizing when we're not okay and being there to support one another. Naz, I have a question for you, just again, riffing a little bit on the comments that Jonny had earlier about that more systemic lens, those strategies, those policies that can be effective. And I'm wondering what you've come across in your research in terms of what you've seen, again, kind of either facilitates or potentially puts people in harm's way with regards to psychological health and safety. I know you touched on workload, but I'm curious to know what else you've seen come through the literature.
So certainly, my panelists, Jonny, Karen, and Michelle already brought up a lot of good points, but around sort of those important factors for, psychological health and safety, research over and over and over points to the importance of effective workload management and staffing levels and, the sort of impact that they have on workplace mental health. And I think one of the, there are obviously many things that can be done in that respect. And probably the end goal would be, sort of increasing the supply of staff for this sector. So sort of promoting our nursing students to pursue a career in long-term care after graduation, or sort of creating a workplace condition in this sector so that professional nurses and staff actually choose long-term care sector as a place of work. But on top of that, I think to sort of promote the mental health of the staff that are already working in this sector, there are sort of some interventions with respect to workload management out there, which are also evidence-based. There's this patient or resident needs assessment tool that sort of is evidence-based. It has been examined, in many countries and has been found to promote staff, residents, and organizational outcomes. And it essentially helps with workload management. And right now, actually, as of probably about a couple of months ago, our research team has essentially started implementing this tool into the long-term care sector. We're actually working with this facility, Louis Breyer Home and Hospital, to tailor the tool for the long-term care sector and essentially implement and evaluate its impact on workload management. But I want to also bring up another point around sort of strategies for mitigating the impact of workplace conditions on staff mental health in the long-term care sector. And I think one of the really important things that we should actually be doing is to ensure that our decisions are actually made in collaboration with staff, with people like Michelle, who are living in the front line, who have those lived experiences. We should be asking them what it is that would help their mental health rather than making those decisions on their behalf. And so another really interesting finding that actually sort of came out of our research was that, staff in our survey study essentially found that the sick leave policy during the pandemic, it wasn't very flexible. It wasn't appropriately flexible. And one of the reasons, being was that staff essentially felt like for them to take advantage of this policy, if they had a physical illness, it was going to be okay. But mental health and mental health needs, they were not a recognized factor for staff needing to take time off from work. So just sort of making some of those considerations, I guess, when we're thinking of staff mental health, in my opinion, would be really, really important.
Well, thank you for sharing your perspective there, Naz. And we can sort of hear the ongoing theme around recognizing the importance of not just physical well-being, but psychological well-being, and how that factors into how people show up for work, whether or not they even stay in the sector to work. And that's actually something I wanted to just return to you briefly on, Karen. You mentioned it in one of your earlier remarks. We talked about the potential exodus of people leaving the long-term care sector, and you referenced one administrator who you were familiar with, looking at early retirement, for example. We've talked a bit about what those working in those frontline positions need. And we know that people in leadership positions have also experienced some significant mental health stressors. What do you see as necessary to support those in leadership positions so they can be there to support their staff?
Well, it's funny, I'm kind of smirking. I guess I've been in the sector so long. When I hear Naz talking about workload management, I actually did a workload management study back in 1989. And the problem in our sector is the moral distress caused by the gap of the things left undone. So when you talk about the worker and workload measurement, I mean, we measured everything that they were doing, but a person who's there for 8 hours can only give 8 hours of work. It's the moral distress caused by I should have done more because this person needed way more. So again, looking at the systemic changes that have to be done, we need to advocate for our sector to have, in 1989, when we did the workload measurement assessment, we determined at that point that our residents in the 8 care homes that we went, and actually Louis Breyer was one of them, St. Vincent's Langara was another, BGH. At that time, care levels were 5.2 hours was what they needed, okay? And since 1989, our clients are much heavier than they are now, or than they were then. So, I dare say if we look at that moral gap of, how many hours of care do they really need? I think they're factored 3 hours of care in assisted living. Well, then they come to long-term care, and we're funded for what, 3.36 if you're lucky, But we know that if someone's passing away, their hours of care needs are way higher, which means that others get robbed of their hours of care because we just don't have enough. So the reality is, for leadership to feel effective, we need to be able to change some of the conditions that our workforce are working under. And we just have to keep hammering home to government and health authorities how detrimental it is to the seniors and to our staff that we're underfunding the sector. And we've got to give the leaders the tools that they can help the staff with. We need more funding. And, I'm not here to complain about funding, but it is one of the key problems in our sector. So we've got to figure it out. And when we talk about staffing, the recruitment challenges going forward, I am extremely concerned about. We're working with government now to get the HCAP program going, but we are very, very short in trying to find nurses and LPNs for our sector. We've got to figure out ways to make it really attractive and bringing people in, because we're burning the ones out who are in.
Well, thank you for that, Karen. I think that's a theme or a thread we've heard throughout this conversation today. I want to take a little bit of time towards the end of our time here today together to talk about what comes next. Because we've talked about what happened. We've talked about the mental health burden. We recognize that people at all levels, in all jobs, in all aspects of the continued care, the seniors care and seniors living sector have been under immense stress. We recognize that there are these larger systemic challenges that factor into that. So my question now is, what next? What do you see as necessary, or perhaps what are your hopes going forward in terms of how we can support people in recovering, in this recovery period, the post-pandemic world? What do people need to be psychologically well, to be resilient in the face of what's been an incredible degree of adversity? And Michelle, I wonder if we can start with you first, your thoughts on this.
There's lots that we can do. I think if we start at the bottom, the staffing level needs to definitely be addressed. That needs to be, I think we just need a whole new model of care. It's not going to work. I can't foresee it happening and maintaining this for the next 10, 15 years as more and more of the next generation are coming into care. From a staffing point, what I would like to see is more in the extended healthcare benefits, more access to counselors and the mental health aspects, more support for us on that side of things. I mean, dental and vision and prescription coverage is amazing, and that's what we need, but we also need to look at the other side. And this is where we need to switch and change our mindset. Even like postpartum care, that can be huge for some women, and transitioning back to work can be hard for them. I know it was hard for me, so I speak from, that's my truth. And, we just need more in the extended health benefits for counseling to get through some issues. Some of the things that are balancing our personal life to make, sometimes our personal life goes into our work life, and sometimes work life seeps into our personal life. So we just need a better foundation there on the extended benefits. And, I think when that happens, that we're going to see a positive change. We're going to see happier staff. Morale's going to go up. I can just foresee it being a happier place to work all around for everybody.
Well, thanks for sharing that, Michelle. And you hit on a key theme there, in that we bring our whole selves to work and we bring our whole selves home. And so the idea of supporting people in their entirety as sort of that new paradigm, if you will, in terms of how we can look at this. Karen, I'm curious to know your perspective as somebody who leads a large team and has immense responsibilities where you're at. What are your hopes? What do you see as necessary?
Well, my first hope is to get life back to more normal. We need to get the families back in a normal way, not in a stifled, measured, controlled, here's your visit, and then please get out. We need the informal caregivers to come in because we know that the burden of what they were doing being back on our staff has increased the staff workload. We need to get where we can hug, because I don't know about you, but I am sure missing hugs. And I often hug residents, I often hug staff, and right now I'm not hugging anybody. And that's part of creating the environment that we love. And being people that care about people, we want to be able to show that again. When you look at my campus, it's 11 and a half acres. I've mainly spent the last year in my office and one back hallway because we've been cohorted. That's not normal. Normally I get to the units and I can see my staff on this site. Well, some staff I haven't probably seen for a year. They've only seen me on Zoom. I want to get back where we can meet in person, where we can share feelings. I did a town hall and I shared some personal feelings about when my husband had COVID in November and some of the things I'm going through. We need to be able to share our stories. We need to be able to have lunch together. I'm having lunch at my desk. That's not healthy. But we can't even sit in the cafeteria together. So we need to get some normal life in, back. And then to get the resources, we used to love our potlucks. We'd love our food trucks coming in. Let's get back to having some fun at work. Our concerts in care, we love concerts in care. We haven't had concerts in care except by Zoom. We need our pet therapy to come back in. We need our volunteers back. So that's what creates our workplace a place to be lived in. So.
No, thank you for sharing that, Karen. And as you're speaking, I'm reminded of the Institute for Healthcare Improvement's Joy in Work framework. And it talks about the vital importance of having joy in your work, not just in terms of providing purpose, but also to address those aspects of psychological health and safety that we all have, the need for human connection, the need to have laughter and joy and warmth in our lives. So thank you for bringing that aspect to the forefront. Jonny, I'm curious to hear your thoughts for the future in terms of what you hope comes next.
Brilliant question, Jen, and I think in many ways, Safe Care BC and other partners are starting down this path with partners in the ministry as well. I think there is an urgent need for a strategic vision and plan to improve staff well-being. I mean, I think there are so many elements for the conversation today that would underpin that, but I think a clear plan forward by our colleagues in the province within the context of health authorities and service providers and health and safety associations like yours, Jen. I think a clear plan for the requisite steps that will need to be taken so that we can address the individual healthcare provisioning that Michelle spoke to and the broader systemic issues. There is such an imperative to co-design, jointly craft that plan going forward, much like we've seen with the Restart Plan and the discipline that's been put behind the pandemic management plan. There is a need for a plan going forward. And I think some of that's in the offing, I hope, from what I've seen. And I think the other part is to go forward. The second of 3 points is the kind of the delineation or the identification of real pathways to care, right? So Michelle's comments, are very resonant for me. Every healthcare worker, whether they're working in a public or a private facility, can and should have clear pathways for where they can go to help. And I think with a view to ensuring that more intensive forms of help are available, hopefully would be part of that plan. And I think finally, it's heavy lifting, right? Policy work, regulatory standards, statutory change, all of those dimensions are challenging to grapple with and poke and grab hold of, but they're so critical. And to comments earlier, making meaningful action on workload management, some of the structural and systemic pieces that drive impacts upon mental health, what should also kind of feature in the go forward, the forward view plan for continuing care and community health worker mental health and well-being. So those would be, my hopes for the future, that a plan gets laid, we have a North Star to walk toward, and we can get the right care to the right people at the right time in the coming months and years.
Well, thank you for sharing that, Jonny. And it's funny that you referenced the restart plan as an example. It's like we need a restart plan, but to address the psychological health and safety impacts of the pandemic and the comprehensive approach to that. Naz, I'm wondering if you have any final comments from your perspective in terms of being embedded in the research on what your hopes are for the future.
Absolutely. So I sincerely think that, the pandemic certainly helped open the Band-Aid that we've been putting on some of those long-standing systemic issues that Jonny, Karen, and Michelle raised during our conversation today in the long-term care sector. And it created this opportunity and this momentum for change. I think the silver lining in all of this and the human suffering and the lives that were lost in this period of time is that it became really evident to all of us and to the general public that we need to be doing a better job of protecting the long-term care sector, its providers, and also its users. And perhaps that can be done through, as we discussed, working together collaboratively, all of us, researchers, decision makers, policy makers, everybody coming together and working towards providing more mental health supports and resources. And by resources, I mean both human resources and also financial resources.
Thank you, Naz. And I feel like this is a topic we could spend much more time to delve into, but I know we're reaching the end of our time today. I again want to say a sincere thank you to our panelists today. So to Karen, to Michelle, to Naz, and to Jonny for joining us and providing your thoughts and sharing your insights on this really important topic. And I also want to thank everybody who's listening to this cast today, and to everybody who's contributed their thoughts in the comments in the chat section. This is clearly a pressing issue for us all, but if it's anything that this pandemic has taught me, it's never underestimate the people, the heart of the people who work in the continuing care sector and their capacity to achieve great things. So thank you once again, everybody, for joining us here in today's session, and we hope to hear much more about this topic as the days go by. So thank you again, everyone.